We have a presentation next by Judith Salerno, who is from IOM, the Institute of Medicine, and she's going to talk about how initiatives at IOM affect our work.
Very little. That's the answer. Well, let me just start off by saying I had fully intended to have a nice presentation with slides and everything, but I had two things happen the past couple days. One is that my domestic goddess responsibilities overtook me, and my dishwasher overflowed and flooded my kitchen. So I've been mopping and bailing out when I should have been doing slides. The other thing that happened is that we have a report that has generated already a lot of controversy. It's due to be released on Thursday, and it's on the use of chimpanzees in biomedical and behavioral research. And right now, many of my colleagues are on Capitol Hill doing briefings, and at 3 o'clock, we've been asked to brief you. Right, OSTP. So, and we were up at NIH yesterday, and we have been fielding reports from all the news media who are chomping at the bit, and as well as many other kinds of research, those with interests. Just to give you an idea of when we do 70 reports a year at the Institute of Medicine, not across all the academies, and we have many which have become, I would say, reached the front page of the newspapers sometimes before they're published, and it's been very interesting. But in terms of the chimp study, I personally received close to 6,000 emails about this. It crashed my server. And so, and this was before we even put together a committee. So just to let you know, what some of these studies generate. And I will talk to you about one study related to women's health, which generated almost as much interest. I think many of you are probably familiar with the Institute of Medicine. IOM is part of the National Academy of Sciences. We were chartered in 1863 by Abraham Lincoln to advise the nation on matters of science and technology, and later health was added with the Institute of Medicine, which is now 41 years old. We were the last honorific society to be added. But in addition to electing people to membership as a testament to their careers in health and medicine, we have a very robust program component. As I said, we generate about 70 reports a year. And the defining quality of our reports, the characteristic rather, is that we provide authoritative, unbiased, and independent opinions. We don't generate original research, but we do provide a review with expert committees of a topic and attempt to provide recommendations that will advise decision makers. And as part of our mission, we're also supposed to communicate around these issues with the public, and I'll speak a little bit more of that in a while. It is surprising to many that unlike a number of scientific societies, we do not receive an appropriation. And we work outside of government when government asks us to investigate a question such as the use of chimpanzees in research. They're not allowed to be part of the process per se, and we have had many occasions since I've been there about 4 years where the sponsor, the person paying for the report, doesn't like the recommendations and wants to change it. But that's not possible because what was requested was independent advice, evidence-based, and that's what we provide. And we don't guarantee what those results will be. So I wish I could report to you that Institute of Medicine has made enormous strides in electing women to membership in the IOM. But I will say that while we've done a much better job than our sister academies, National Academy of Engineering and National Academy of Sciences. We're still up at about 36% maximum number of women elected every year. And when we have a process where we put aside a number of slots for underrepresented groups and encourage nominations, but it's all about nominations. And we get thousands of nominations, and to try and see that more women and underrepresented groups are part of the membership and are elected, we really need nominations. And it's often that, and I try and stay very far away as executive officer from the nomination process. It's an election by peers, and we very much try to make that something where we have nothing to do with it, but other than encourage nominations. So that's all I can stand before you and say at the moment. So in my programmatic role, I represent the Institute of Medicine on the National Research Council, and there are 6 divisions of the NRC, and I must say that I'm the only female of that group. And while it's not intimidating to be in that leadership group, I must say it's a bit lonely. And I believe that what we see in the academies is just a reflection of what we see in academia and in the scientific establishment. So while I would like to have more female colleagues, I think that's probably something that we should, at the academies, aspire to. But I think we're looking at a much broader problem, and one which you're well aware of. So, but what I do hope to do in my role as a leader in the academies is to be a model for women. And we have a lot of women who work at the Institute of Medicine in particular who are relatively early in their careers. And I must say that a great number of them are what I call refugees from the lab. They've given up on scientific research as careers. And they're wonderful colleagues, and they make wonderful contributions, and they're terrific staff. But I feel that part of my role is to take and be a role model in some ways for this amazingly competent group of women. My background, I'll tell you a little bit. Before I came to the Institute of Medicine, I was a deputy director at the National Institute on Aging, and not a laboratory researcher at that point. But way back in the day, I did indeed work in a neuroscience lab. And I had my 3rd child when I was about 4 years into a tenure track position at NIH in an intramural lab. And my lab chief told me after the birth of my son that he had to take away the protocol that I had written and gotten support for and executed, and had a number of subjects already enrolled, because he didn't think that a woman with 3 children could handle it. Oh, back in those days, I guess it was okay to say those things now. But today the bias is a little more of stealth bias, unconscious. I'm not sure I buy the unconscious, but certainly stealth. No one would say that today. But suffices to say that was the last time I ever worked full-time in a lab. I left the next week. And so I have no idea. I've had a wonderful career, but I have no idea what my career might have looked like had I stayed and gone on to a tenured position in research. So I really feel that because of my personal experiences, that I can do a lot to make sure that the culture of the Institute of Medicine is more accommodating to women, and I often find that I'm sharing my experiences about balancing work and life with my younger colleagues. I'm a single mother of 3 kids and have been for a very long time, and I encourage them in talking about their struggles and their attempts to balance their lives, to be upfront about it and to not make excuses for reasons that they need to be at their kids' play or whatever, and that we really need to encourage people to be upfront and non-apologetic about things, decisions, and priorities that they need to make at different times in their lives. And at times in their lives, different times in their careers, work will come first before family. So it's kind of like I try to project the idea to the women that, that you can't, that it's a myth. For me, personally, it was a myth to say my family always comes first. It's that things have to come, something is always on the front burner, but whatever it is, depending on the time and the priorities, that changes. So anyway, but let me tell you a little bit about things that we have done over the past year at the Institute of Medicine, which resulted in reports which I think can have a profound influence on the lives of women. So I'm going to share a few examples for you. One is, in October of this year, we released a report on preventive services for women, and that was as a direct request coming from the Affordable Care Act, the Health Reform Act. And our committee enumerated 8 different preventive services for women that included cervical cancer screening, counseling on interpersonal and domestic violence for women and adolescents, services for pregnant women, including screening for gestational diabetes, well women annual visits, and, yes, access to contraception. So under the Affordable Care Act, the recommended preventive services have no copayment or deductibles or any charges. They're free. So as you might imagine, the headline about an hour after we released the report was IOM recommends free birth control. And that is what everybody focused on. And there were a lot of other really good things there that I think needed a lot more attention. So I bring this to you because I hope that if you are interested that you will go and read it and find out about these other things that are recommended, and most of the recommendations have been accepted by HHS. We have also been on the receiving end of some not very welcome opinions by the Catholic bishops on our evidence-based stance on use of and access to birth control for women. In September, we issued a report on a workshop that was held in January. And the topic of the workshop was preventing violence against women and children from a global health perspective. Now, across the world, violence against women and children poses a very high burden on health. And women and children are particularly susceptible to violence because in many societies they have fewer rights and few legal protections. And the perpetrators are often family members or intimate partners, and women are often hesitant to report the crimes. So over the last decade, researchers have gathered data on the growing magnitude of this violence, and we know that there are substantial knowledge gaps, and we are hoping that with the ongoing activities of our violence prevention forum, that these activities and these issues can be brought to light, and that will help raise awareness of these issues. I want to talk to you about a landmark report that was published a little over a year ago, and I say that it's already become a landmark because it's the most widely read report of all the Institute of Medicine reports, and every month consistently gets more page views than any other report that we have issued. Last month it was 18,000 page views and thousands of downloads of the free PDF, and that's on the future of nursing. And while it's not necessarily a woman's issue, it is a woman's profession by and large. Nursing is dominated by women. And what the report sets out is a blueprint for really nurses to lead transformation in healthcare. And I think that this is really important because we had a committee, put together an expert committee that was led by one of you, Donna Shalala, who, Secretary Shalala, has really been outspoken about the need to address issues related to nurses practicing to the full scope of their capability and licenses. What this has done is created a report that's not written by nurses for nurses. It's a report that was written by a broad swath of health economists, yes, some nurses, university presidents, physicians, a whole broad array of people who looked at the issues that we're facing as a healthcare system and came to the conclusion that nurses are a key part of the answer to how we're going to provide access to care in the coming years. So that has really catapulted this report into the spotlight and has generated a whole host of activities, and there are now about 22 states which have projects where they're promoting the development of nurses as leaders, and that's the key, that nurses can be leaders. And just last week, a new report was issued at the breast cancer meetings symposium in San Antonio, and it was on breast cancer and the environment. And the report looked at the epidemiologic evidence on the risk of exposure and risk in the environmental exposures and risk of breast cancer. And it reiterated the risks of things like ionizing radiation, weight gain, smoking. It found not very substantial evidence on other things such as hair dyes, air pollution, BPA, that sort of thing. But I bring this to your attention because the whole idea that the Institute of Medicine provides advice to policymakers and decision makers and the public. We've been missing the public for a long time here, and I think the breast cancer report is something like 375 pages with lots of appendices and references. What we did is we distilled it into a very simple, readable brochure with nice pictures, nice graphics. That's a Q&A on should I avoid mammograms related to this topic. What does it mean when I read that something increases risk for breast cancer by 20%? It's pretty straightforward. And we took the money and we invested in doing this because we felt that this was an issue that once the report came out, where it would be so difficult for women to access that information, and this represents a whole new type of activity that we've engaged in, really trying to put scientific evidence out there in a accessible way to people who really want to know answers. So I brought about, I guess probably not enough for each of you, but I brought some copies of this just to show you where we're going, and that's part of what I've been trying to institute across the Institute of Medicine, across the Institute. Because I think that this is really a part of our mission that we have really not done enough on, and that's across the academies as well. So what's lining up for the coming year? Well, some very, very interesting new studies that we're going to launch this year. and one, I'm pleased to say, which is supported by the Department of Justice and may be something that seems a little out of bounds for the Institute of Medicine, but it's on looking at sex trafficking of minors. And this is well beyond health, but we feel that this is a study that really will piggyback on some of the efforts that we're looking at it on violence against women, and really open up a whole area identifying that we know that there's not a lot of work in this area, but we hope that we can identify areas where we need more information and increase awareness of this issue. So I'm very pleased that the Department of Justice saw this as a very important issue and has decided to fund it with a significant amount of money. We're going to be holding in probably around June a workshop on sex-specific reporting of scientific research. And this is a follow-on to the IOM report of last year on women's health research. We hope with this workshop to explore the benefits and barriers to sex-specific reporting of scientific data, and to really address head-on why there is a need for sex-specific reporting and what are the perhaps unintended consequences of collecting this sort of information. We'll also be launching a new standing committee on family planning and looking at emerging issues in scientific, workforce, health services, and education issues related to family planning. This is an area that's become almost up there with death panels as a bit radioactive. So we're happy to step up to do that kind of work where we can use our reputation as evidence-based, authoritative, and independent to arrive at to present information and arrive at recommendations that can advance our understanding of these issues. So I'm going to have to probably leave later this afternoon to get back to chimps, but I would be happy to hear from you what you think we can do better or do differently. Now, you should know that the Institute of Medicine is a soft money operation. That is, we don't get an appropriation, and we are looking for, and when we want to do a study, we have to find someone to support it. So, we're always looking for the areas where we can be there, where other people can't, where government can't to work on this. We're probably going to, if we can get a little bit of money, do a workshop, for example, on contraception research, because that's an area that doesn't seem to be in favor for funding by government sources now, and we think it's an area that needs to be addressed. So that's the kind of thing we can do. If you have any ideas about what we should do or how to help us or who might fund us, I'd love to hear them. So thank you.
I have a question about the nominations. Do you think that you say you need nominations? Are women as forthcoming about nominating themselves or other women? I mean, that's considering how many women are in medicine these days, that's such a small number. Do you think women are as forthcoming about promoting themselves for membership?
Well, you have to be nominated by a member, and I think that part of it is that it's sort of, as somebody mentioned before, sort of a lifetime achievement recognition, so that you have to be distinguished in your field in order to be nominated and and elected. So we're still looking at the residual. Women are up and coming, but there are not as many women who are in the 50, 55-year-old plus group as men, relatively. So I think that, and it's an election by your peers. So I think that We're underrepresented, we know, in areas like nursing. But it's, I encourage my nursing colleagues to nominate other people who are distinguished in their field. So that's really the key.
The wonderful brochure, do you have that also on the web so it can be downloaded on breast cancer?
Absolutely.
Okay. So just if we go to the IOM site, we can find it?
Yeah, and as of earlier this year, all of our reports are available for free. You can download the PDFs, so you don't now have to spend $40 on the reports. So.
The numbers are encouraging in terms of new nominees. What is the percent of women in the IOM currently?
I knew you were going to ask me that. I think it's in the vicinity of 22 to 24%, with 30 to 35% newly elected members with each class.
Tell me a bit more about how you're going to do this contraceptive research.
I don't.
Questions you ask of whom?
I don't know. I'm not an expert, but what I do is I pull together a planning group of people, a small planning group, to try and brainstorm this and then come up with an agenda for a workshop. And often, we have an expert meeting that would precede a large public workshop. It depends on how much money I can squeeze out to do this, actually.
Thank you. I've enjoyed your talk. I know that it's either 2007 or 2009, there was a report by the by IOM on the fact on the workings of an interprofessional team. Now, you've just put out a report on nursing, but there was a report that was encouraging that the future of medicine really should be team-based care. The team is going to be very important in the Affordable Care Act and the medical home, irregardless of whether the Supreme Court knocks it all down or not. I think the train has already left the station because there is not enough primary care physicians. Is the IOM going to look further at the composition of teams, particularly concentrating on some of the other professions? I happen to be dean of a pharmacy school, and pharmacy is 65% female now. And I know that some of the other professions are 65% female. And medicine itself is graduating more females than men. And that's going to change the whole complexion. Are there any plans to look at maybe the composition of these teams and how to encourage them further, irregardless, like I said, of what could happen in June?
I'll answer that in two ways. The answer is yes and yes. After the Future of Nursing report came out, we heard from a lot of physicians groups. And as I expected, they were not happy with saying that nurses can lead and that they can provide independent practice and help solve some of the medical shortages. But we thought about this and thought about convening groups of health professionals, doctors and nurses perhaps. But what we are doing, and we have raised about 80% of the funds, and we hope to launch this by March of 2012, is a large forum on health professions in the 21st century, and largely focused on interprofessional education and practice. And what we do with our roundtables and forums is that we ask groups that they don't come up, they're not like consensus studies where they come up with a series of recommendations. They're neutral convening activities, a neutral ground where people can talk, government, industry, professional organizations, academics can all sit around and talk of issues of common interest and put them out on the table and decide, how to move some of these issues forward. And I'm quite sure we have now, I think, something like 12 different national professional organizations. Quite sure pharmacy is in the mix. Veterinary medicine and nursing, social work, gerontology, all these groups. So we're hoping that this will be a really important focal point for pushing this agenda forward. So we're very committed to it, and it stems from also not only the Future of Nursing report, but an article that was published about a year ago in The Lancet on health teams after Julio Frank from Harvard School of Public Health chaired a group looking at this. So we're very pleased that there's so much interest in this. It is the future.
Yeah, I have a question about the source of your funding. So for these consensus studies, you need a certain percentage to come from the government. What
No.
amount, or 100%?
I'll take anybody's. No, that's not true. There's no certain percentage. It depends on who really wants the question answered and who cares about the question. Like the breast cancer study was entirely funded, 90% funded by Susan G. Komen.
Okay.
We have some studies that are entirely government funded. One hard and fast rule is that no matter what the activity, no more than 49% can come from industry, so of our funding. So that's and we do very, very detailed bias and conflict of interest discussions before people are allowed to serve on our committees. Okay, I'll leave some materials on the chair. Thank you.